I rise today to offer an amendment to H.R. 987, the Strengthening Healthcare and Lowering Prescription Drug Costs Act. The Navigator program is crucial to communities like El Paso, where we have one of the highest uninsured rates in the state of Texas. Navigators provide free assistance to my constituents as they maneuver through the marketplace to find a healthcare plan that is right for them. When funded adequately, these programs help decrease the uninsured population across the country. However, the Trump administration has sought to cut funding for the Navigator program in its plan to systematically undermine the Affordable Care Act. By slashing the program's funding by 84% over the last 2 years, the total funds allotted for it now stands at $10 million. To exemplify these draconian cuts, consider this. In 2017, there were 9 Navigator programs funded in Texas and 2 operating in El Paso County. In 2018, the number of Navigator programs in Texas dropped to just 2, with only 1 now operating in El Paso County. This presents a challenge to states and districts like mine that have seen their populations increase over the past decade. The Center for Medicare and Medicaid Services has coupled deep cuts with a rule overturning a requirement for Navigator programs to train their assisters to help individuals with chronic illnesses and limited English proficiency. While the Trump administration claims this will give navigators more flexibility to tailor their training for the populations they serve, it is really another attempt to scale back what has proven to be a successful program. By cutting funds and reversing this requirement, Navigator programs will be forced to choose between extra training for their assisters or hiring more of them to cover counties now lacking operational programs. Navigator programs that do not provide proper training could result in their assisters being underprepared when a consumer from a vulnerable population comes to them for assistance. Enrolling in the marketplace can be complex for anyone, especially for those whose primary language is not English. While H.R. 987 restores funding to the Navigator program, we must ensure these programs continue to train their assisters to help underserved populations. My amendment does just that by requiring navigators to provide training for their assisters to serve vulnerable populations, including individuals with chronic illnesses and limited English proficiency. In my home county of El Paso, there are almost 25,000 uninsured individuals who are not English proficient. This amendment will ensure Navigator programs are able to help all El Pasoans find suitable health care plans. Simply put, Mr. Chair, access to affordable health care is a right, and my amendment ensures we make every attempt to leave no one behind. I urge my colleagues to support this amendment, thank Representatives Torres and Porter for their co-sponsorship, and reserve the balance of my time.